Thank you for having me here today. My name is Arielle Spellun, and I'm a developmental behavioral pediatrician at Boston Medical Center. So in the United States, about 1 to 2 of every children born is deaf or hard of hearing, and that number increases as children age due to acquired or progressive or late onset types of hearing differences, reaching up to 1 in 5 children by the time they reach 18. And why does this matter? Because children who are deaf or hard of hearing are at increased risk for reduced access to language during the critical period for language development, really regardless of their hearing status. There are many ways that children can get access to language when they're born deaf or hard of hearing. That includes through visual languages like sign language and other technology or language access tools like cochlear implants, hearing aids, or augmentative and alternative communication devices, which are shown here. While newborn hearing screening is really robust and successful in the United States and identifies many children, what happens after screening is where we tend to lose children. And so in 2022, the year that we have the most recent data from, although greater than 97% of children who were born in the United States were screened for hearing differences, only 40% were actually enrolled in early intervention by the time they reached 6 months, which is the recommended time to receive early intervention services. Beyond early intervention, access to hearing health care and improved developmental outcomes are highly impacted by social determinants of health, whereby individuals from marginalized communities and reduced socioeconomic status fare worse in their developmental outcomes and their access to care. After a child is first identified as being deaf or hard of hearing, their family has to navigate a huge journey with them. They go to multiple medical appointments for an evaluation. They're faced with decisions about technology, potential surgery, advised to learn a new language, enrolling in early intervention, which means having strangers potentially come into your home, having to connect with other therapies and community supports. 40 to 60% of kids who are deaf and hard of hearing have additional developmental and medical diagnoses. And there's also decisions about educational enrollment, so a lot. When you layer on top of that families who've experienced trauma, families experiencing grief of an unexpected diagnosis, families trying to get insurance coverage, housing, food insecurity, limited literacy, and immigration and marginalization, it's no surprise that those children have worse outcomes long-term when it comes to their language and developmental outcomes. And so how can we improve? We're currently undertaking a study, mixed method study, to try to understand at Boston Medical Center, a safety net hospital, who are the deaf and hard of hearing kids that we see here, and what do they need? What do their parents from multiple backgrounds feel like they need, and how can we help them? In our mixed methods, in our quantitative study, we're looking at deaf and hard of hearing children who were seen at Boston Medical Center between 2018 to 2024, which we've reviewed their records and confirmed that they have a permanent childhood hearing difference, and we have 343 children in this cohort so far, and looking at demographic factors, clinical factors, and how they impact their access to care. And we're also doing qualitative interviews with providers and caregivers in at least 3 languages. Our most most common at Boston Medical Center: Spanish, Haitian Creole, Portuguese, and hopefully Vietnamese, depending on research assistant availability. And the goal is to use this information to develop a program that is actually based on the needs of our patients and families, implement that, evaluate our effectiveness at improving access and reducing disparities, and figure out how to scale this through other safety net settings that support deaf and hard of hearing children across the world. Thank you.